Okay, everyone, let's go ahead and get started. Good morning and good afternoon to those of you who are calling in from the East Coast and other time zones. I'm Lori Schellenberger, Director of the ACLU of California's Voting Rights Project. The ACLU, along with our partners and co-sponsors who are on the screen in front of you, CalPIRG, the California Voter Foundation, the Greenlining Institute, Health Access, the National Association of Community Health Centers, Rock the Vote, the Western Center on Law and Poverty, and Young Invincibles. We all want to thank you for participating in today's webinar on voter registration in Covered California. Before we jump into voter registration, I'd like to take a minute to congratulate the board and staff at Covered California, some of whom are joining the call, who are making affordable health care a reality for millions of Californians. They had their board meeting yesterday, the last meeting they will have before the October 1st launch, and what they've accomplished and the ways in which they'll be delivering services are really leading the nation and setting a bar not just for other states, but for the way in which government can interact with and provide services to consumers. And I know there are a lot of people on this call who worked with the board every step of the way on this over the past couple of years, and I want to congratulate them as well. It's a really exciting time. I think it's important to point out as we start this discussion about voter registration at Covered California that when they were approached over a year and a half ago about including voter registration as part of their application process, the question from them was never whether or why voter registration should be incorporated. The only question from them was when. When can we do this? When can we get this done, given everything else they were trying to achieve by October 1st? And so we are thrilled that with the urging and support of the California Secretary of State and others, many of you are on this call as well, they've achieved what many thought was impossible. Millions of Californians applying for health care coverage will simultaneously be offered the chance to register to vote. And we're the first state to do this and the first state to utilize our new online voter registration system to get it done. I don't think I can overstate what a truly important and unique moment this is in California. Thousands of us are coming together and around a shared vision and a shared purpose. We want to reach those who've been excluded from our healthcare system and those who've been excluded from our democracy. And we are coming to realize how interrelated these problems and their solutions are. And I think this historic opportunity is probably best demonstrated by the incredible diversity of groups on this call today, and I just want to share that with you. We have representatives from food banks and school districts, from community health clinics and independent living centers. There are state and national health advocacy groups, voting rights groups, and disability rights groups on the call. There are church-based outreach and get out the vote groups from across the state, as well as small community-based outreach groups doing education among their neighbors. We have county welfare directors and multiple unions represented on the call. There are national and regional foundations participating, as well as advocates from other states with state-based health benefit exchanges. And we have media participating today, including Spanish language media, committed to spreading the word about all of the opportunities that Covered California will be offering into those communities. I believe this is the beginning of something incredible. It's a big work in progress, and it may be a little messy at first, and we all know that. But I hope the incredible group that's come together for this call will continue a dialogue that we will share our experiences as we rethink community engagement and develop best practices moving forward, and we'll be following up with all of you as we create a space for that continued dialogue. And with that, let's get started, and I'll briefly introduce the panel and tell you what we're going to cover today, and then I'll turn it over to them. Our first speaker is Elizabeth Landsberg, who's the Director of Legislative Advocacy at the Western Center on Law and Poverty, and the leading expert, I think, on the Affordable Care Act and California's implementation of that law. She's going to talk today about how enrollment at Covered California will work and give us really a context for the voter registration piece of this. And then she'll turn it over to Raul Macias, who is our very own voting rights advocate and leads our NVRA implementation project at the ACLU of California. And interestingly enough, was the first person who said to me 2 years ago after coming to the ACLU from a summer monitoring the health benefit exchange during an internship at the Greenlining Institute, one of our partners, and he said, I think it'd be great if people could register to vote when they apply for health care, and he's been working on it ever since, and he'll be sharing what we know about how voter registration is going to work at Covered California. Marc Wetherhorn is the Senior Director of Advocacy and Civic Engagement at the National Association of Community Health Centers. Marc has developed incredible models for voter registration and engagement at community health clinics where trusted health advisors are supporting their patients who are participating in our democracy often for the first time. And he's going to share those models with you as you think about the ways in which civic participation can lead to overall personal and community health. And then finally, Heather Smith was scheduled to speak from Rock the Vote, but is actually testifying today about online registration before the Presidential Commission on Election Administration. But speaking in her place is the equally dynamic Amanda Brown, who is the National Political Director for Rock the Vote. And in addition to doing national policy advocacy that impacts young people, you might have seen Amanda standing next to the President when he signed the student loan bill. She also works with groups across the country to make voter registration more accessible and more exciting for youth, and has spearheaded innovative programs that increase turnout among youth. Amanda's going to be talking today about a free tool that and yes, that's what I said, free. Rock the Vote has a tool that they provide to organizations doing civic engagement work that helps them manage their outreach, makes voter registration easier, and can help you increase voter participation among the populations you serve. So please send us your questions during the webinar in writing. On your control panel along the right-hand side of your screen, you should see a tab labeled Questions. Please type your questions in that box, and we'll do our best to answer them at the end of the presentation. And if you have to jump off the webinar, we're recording it, and we will send you a link as soon as it's uploaded, and hope you'll share that with your networks. So with that, let's get started, and I'm going to turn it over to Elizabeth Landsberg.
Okay. This is Elizabeth Landsberg with the Western Center on Law and Poverty. Very pleased to be here as part of this important webinar. Western Center on Law and Poverty is a statewide organization advocating for the needs of low-income Californians, and we work in 3 areas: healthcare, public benefits, and housing. So we're going to talk about the new healthcare applications, which are scheduled to go live on October 1st. The focus of today's webinar, of course, is about the voter registration, but we did want to make sure that people had the basic understanding of the different ways that health consumers will be able to apply for the new coverage options as background before we get into the voter registration piece. So I'm going to go through each of the application venues and we'll talk about them in some detail. So the Affordable Care Act really brings a whole new approach to applying for subsidized and public health coverage programs. Today, the onus is really on the consumer to figure out what they're eligible for and where to apply. So if I apply for one program, a county program, and I'm turned down, I have to start a new application process for AIM or for the high-risk pool or for Medi-Cal. A fundamental change with the Affordable Care Act, in addition to expanding health coverage options, is this notion of a no wrong door application. So wherever I apply, I'm going to be determined eligible for all of the health coverage programs that are available. Medi-Cal, which is a free or low-cost program, the exchange, either with the premium subsidies or without, and then the AIM, which is an access for infants and mothers program for pregnant women and their babies. So really a new approach to health coverage application systems. So under the Affordable Care Act and under California law, people have 4 different ways they can apply for these new health coverage options. They can apply online, either through the Covered California website or the SAWS portal, and I should have spelled this out. But the SAWS portals are the different county-based social service systems. So if you go to calbenefits.org, you can get linked to your county and apply for benefits online. Consumers have the right to apply by phone, again, either to the statewide Covered California Service Center, or they can call their county social services office. People can send mail either to Covered California or their county, and then people can also apply in person. The in-person venues are either at their county social services office or with a certified enrollment counselor. Covered California doesn't itself have an in-person application option where people can meet with a Covered California employee, but the county workers at county social services offices will be trained on Covered California tax subsidies and health plan choice and the like. Okay, so a little bit of background. We've already talked about Covered California, and that is sort of the public name that's being given to the California Health Benefit Exchange. So there are two different websites hosted by Covered California. The one where consumers will actually go apply for health coverage is this coveredca.com site. And again, that's where people can go today to look at the calculator and calculate the subsidies they're eligible for. And starting October 1st is where they can actually apply for health coverage. There's also a website focused on board materials and process. I've heard it recently referred to as the GEEK website. That's healthexchange.ca.gov. And there you can see the regulations that have been passed by Covered California about how they're working, information about all of the board meetings to date, and all of their materials. So a lot of very important background information on the board website. I should also mention that the coveredca.com website, the consumer-oriented website, has a lot of good fact sheets and information that you can download for outreach events, and they've been great about translating them into multiple languages. So there is a lot of information in the different California languages. Okay, now we're going to go through each of the application venues, starting with the online portal, coveredca.com. And I think this is kind of what's been getting the most focus, and we're very excited that the board announced that it's looking like people will, the full launch will be ready on October 1st, just days away now, and people will be able to go onto this coveredca.com website to apply directly for health coverage. So someone can, sitting at home, at their kitchen table with their computer apply. They can go to a library anywhere. They can go to apply. There are definitely ways for people to get help as they're applying online. They can call and get help over the phone as they're applying. There's going to be some online chat functions. But ultimately, people will be able to go on, log in, enter a user ID number, and apply for coverage, as well as getting notices and information and updating their information on the phone. These various venues are very much being branded as Covered California, but it's important to note again that with this no wrong door, this is a Medi-Cal application and an avenue for Medi-Cal. So you can see over to the right, it's made a little more clear that this is a Medi-Cal application as well. This Covered California website will be available in Spanish, and then we'll talk more about the paper application, which will be available in additional languages as well. Applying by phone, people do have the right to apply by phone, and there are both a Covered California service center with 3 different locations that will take phone applications. I think a lot of the call volume that the service centers are already seeing are people asking questions. We anticipate that the service center will be used for people who need to ask questions while they're doing an online application. But people can actually apply by phone. This is a new thing for Medi-Cal health coverage. But both Covered California and the counties will be able to take phone signatures. We do list the service hours for the service centers as well. The county social services offices can also take phone applications, and again, this is for any of the health coverage programs. Okay, in addition to these venues, there's the paper application, and this is a picture of the latest draft that we've seen. One thing we're really excited about is this front page shows the 11 different threshold Medi-Cal languages with a designated 1-800 number where people can get assistance. This paper application will be translated into those same 11 written languages, and the back of the application has information in each of the languages about how to get the application. The paper application is, at this point, 33 pages long, but that includes a lot of appendices or appendixes, as well as some frequently asked questions at the end. Really, there's about 3 pages that each applicant has to fill out. So hopefully, California's made it as streamlined as it can be. Again, want to emphasize that this paper application can be used for Medi-Cal and Exchange. That AIM program for pregnant women will be added. For non-Magi Medi-Cal, which is the traditional Medi-Cal program, counties will have to get additional information, but this paper application will start the process. For all of them, there is information at the back about voter registration, both a frequently asked question and also a link to the Secretary of State's website. We'll hear more about that. Okay, and last but certainly not least, people do have the right to apply in person. And again, Covered California doesn't themselves have an in-person venue, but people can go either to a community-based organization that has certified enrollment counselors, or they can go to their county welfare office. So we think of the county social services offices as primarily doing programs like Medi-Cal and food stamps, but the county workers are all being trained on these Covered California or exchange subsidy eligibility issues, as well as how to help people pick a Covered California health plan. And then there are thousands of Californians who are signing up to be certified enrollment counselors. These folks do have to get special training and be certified by Covered California, and they can receive $58 for enrolling someone in the exchange. And then the California Endowment has provided funds to provide the same compensation for enrolling folks into Medi-Cal. So we're really happy to have a cadre of application assisters, now called enrollment counselors, that can help individuals apply for and then also renew for health coverage. So very happy again to have participated, and I think we'll be taking questions at the end. Thank you.
Hi, everyone. As Lori mentioned, we've been working with the Secretary of State and the exchange on the implementation of voter registration at Covered California. The requirements we're going to talk about were added to the 1,000 other things the exchange was working on in May this year. And we've been very impressed with how much California has been able to accomplish in a very short time to make sure most applicants would be offered a chance to register to vote from day one of the launch. So in May this year, the Secretary of State designated the Health Benefit Exchange as a voter registration agency under the Federal National Voter Registration Act, which is known as the NVRA for short. There are also California election laws that apply to voter registration agencies. The NVRA took effect 20 years ago and it aimed to reach underrepresented Americans by having some government offices take an affirmative role in registering people to vote. In California, we still have a lot of work to do when it comes to registering people to vote. Many people don't realize that voter registration is a problem here, but there are nearly 6 million unregistered voters in the state. California's voter registration rate ranks 45th in the country right now. And one of the reasons this is such an exciting opportunity is that the same people enrolling in California are often the people we know have lower voter registration rates. Now that it has been designated as a voter registration agency, the NVRA requires Covered California to provide voter registration services whenever someone applies for health care coverage, renews their health care coverage, or notifies the agency of a change of address. This means that under state and federal law, any entity, whether public or private, that is under contract with Covered California to accept or administer applications for health care services must also provide voter registration services. So what providing voter registration services means is that an entity or enrollment counselor must do 3 things. First, provide a voter preference form, which is a form that asks a person if they want to register to vote and includes disclosures that, among other things, make it clear that registering to vote is not a condition of receiving benefits. Secondly, unless the person answers no to the voter registration question on that voter preference form, they must provide a means for the person to register to vote at that time, either with a voter registration card or through the online voter registration system. And third, they must provide assistance in filling out the voter registration card or answer questions about the online voter registration process if the person requests assistance. So how is this going to work at Covered California? Well, we're excited to announce that Covered California was able to incorporate the voter registration question and a link to online voter registration into their online system so that it's ready for the October 1st launch. As we understand it from our discussions with Covered California, there will be 2 occasions when applicants could be asked if they want to register to vote. When they create an account, online, and when they complete the online application for coverage. That first option was explained a little bit differently at the board meeting yesterday, so it may be that rather than when someone being asked when they create an account, an applicant will be asked if they would like to register to vote on their individual home pages. We've not seen the voter registration question page that appears after a completed application, but it sounds like it appears when applicants are asked if they would like to apply for other programs like CalFresh or CalWorks. If they answer yes to the voter registration question, they will be taken to the Secretary of State's online voter registration website. We understand the online registration website will appear in a new tab and not in a pop-up window. At this time, the voter registration question does not include the legally required disclosures that we're going to talk about in a couple of slides. So here's slide 5. This is the first page of the online voter registration form. Currently, the online registration is only available in English and Spanish, although it will be available in 8 Asian languages in the spring of 2014. I'm going to talk about the voter registration options for Asian language minorities in more detail in a minute, because this is going to be a challenge. And unfortunately, the current version of online voter registration is not accessible to screen readers, but it is expected to be updated in the spring of 2014. Okay, earlier Elizabeth discussed certified enrollment entities and counselors as an avenue for applying for Covered California. Enrollment counselors will receive training from Covered California on voter registration. Just so you're aware of what applicants should expect and are legally entitled to, enrollment counselors are required to encourage applicants to answer the voter registration question. If an applicant decides to register to vote, counselors must give the applicant the time needed to complete the voter registration application. Be aware that the online registration form can take about 5 minutes to fill out, maybe sometimes more. Enrollment counselors must notify applicants of the availability of assistance with voter registration and provide such assistance, but only if the applicant requests it. So it's important to note, especially since California has not yet included this information along with the voter registration question, that applicants have the right to assistance, but they also have the right to apply in private without assistance. So for example, an applicant who does not want to disclose his or her party preference to that counselor, they might prefer to fill out an application without assistance. And finally, while the current version of the online application does not make this disclosure, it's important that applicants know that registering to vote is not a condition of receiving benefits. We have concerns about how all of this is actually going to work and will likely be a work in progress. For example, will enrollment counselors be willing to spend another 10 minutes with an applicant after a lengthy Covered California application? Or will an enrollment counselor be willing to let an applicant fill out the online voter registration form in private if the applicant does not want assistance? So we're hoping organizations like the one on this call can let us and let Covered California know how this is playing out in practice and even share best practices or suggestions for others. So we've talked about what should be happening regarding voter registration at Covered California. Here are some of the things to watch out for that should not be happening. The NVRA is clear that certified enrollment counselors must never discourage an applicant from registering to vote, must never influence an applicant's political party choice, and must never do anything that might imply that registering to vote is a condition of receiving benefits. As I mentioned at the beginning, Covered California is required by state and federal law to provide each applicant with a voter preference form and voter registration card. This requirement applies whether a person is applying in person or remotely, such as by mail. And while paper applications are not expected to be the bulk of applications, at this time Covered California will not include voter preference forms and voter registration cards with those applications. That's not to say certified enrollment counselors cannot add those forms to paper applications they distribute, but we do not believe they're being instructed to do that. People that mail in paper applications will also not be mailed a voter preference form or voter registration card at this time. For now, the Secretary of State's toll-free number and the URL to online registration will be included in the FAQ at the end of paper applications. And this is another area we're going to continue to monitor, and we've been assured that Covered California will come up with a solution soon. Under the NVRA, applicants must receive voter registration services even when they apply by phone. At this time, Covered California is not prepared to send applicants that want to register to vote a voter registration card. Instead, if an applicant wants to register to vote, they're going to be given the Secretary of State's toll-free number to call. Our understanding is that Covered California has every intention to get their service centers fully compliant, and we'll continue to monitor this as well. If a service center determines that an applicant is Medi-Cal eligible and transfers them to the county welfare office, that county office is already an NVRA agency and is required to provide the applicant with voter registration services when they apply for assistance there. And so lastly, we want to make sure everyone is aware that the Federal Voting Rights Act requires that voter registration materials be provided in Spanish in many counties and in multiple Asian languages in 8 California counties. You can find out what languages are required in your county by going to our website, and it's listed in the blue box on this slide. And these language requirements apply to voter registration through Covered California as well. As I said earlier, online voter registration is currently only available in Spanish and English, although it will be available in 8 additional Asian languages in spring of 2014. Until that time, certified enrollment counselors and enrollment entities can get forms in required languages from their county elections offices. Voter registration cards are also available in 8 Asian languages on the online registration site, but these printable forms do not have prepaid postage and are not NVRA compliant unless the completed form is mailed or delivered to the county elections office on behalf of that applicant. In addition, as many of you know, and as Elizabeth explained, Covered California will have paper applications available in 12 languages, but voter registration cards are only available in 10 languages. So it's important to remember this is still a work in progress, and Covered California is committed to ensuring a seamless voter registration experience for all applicants. But for now, we would encourage anyone doing voter registration to do whatever possible to provide equal assistance to people who are not proficient in English.
Hi, this is Marc Wetherhorn with the National Association of Community Health Centers. I appreciate the opportunity to talk to you all today. I can say that we're working with health centers in states all around the country, and so California is, to say the least, as usual, unique. But I want to talk a little bit about what we're encouraging our health centers to do and what we're providing for them as they as they are involved in voter registration and enrolling people in coverage for the ACA. Now, unlike California, most states have not designated the exchange as a public assistance office for voter registration purposes, so we're taking the position that our folks need to understand that whether it's required or not, it's something we want to do because elections matter. The populations least likely to vote are clients at our health centers. We're a trusted source, so I think it makes a huge difference whether folks at health centers are asking folks if they want to register to vote when they enroll or someone else, and because we can make an impact. About a year ago, somebody was talking about they started thinking about this a year ago. About a year ago, we started thinking about this as an opportunity to engage our patients in voting. Millions of people are going to be coming into health centers to enroll in coverage. This is especially true in California. And a lot of our health centers already enroll people in public assistance and are engaged already in helping people register to vote through when they apply for Medicaid, or in your case Medi-Cal or WIC or other public assistance. So in many cases this is not new. The activity of registering voters as part of an enrollment process is not new to many health centers. But I think it's important to understand the scope that we're expecting going forward, so that we need to really think about how we can do this at health centers. And so rather than try to figure out how to do this in a variety of ways, because voting is controlled by the states, we're trying to come up with what amounts to a fairly standard approach, so that whether the state requires it or not, our folks can effectively register voters when they're enrolling them in coverage. So what we're telling our folks is they really have to think through the process. And again, I can't speak specifically to California because it's a little different from many other states, but we don't expect folks are going to wander in to enroll. They're going to be contacted, and they're probably going to be reminded to come in and bring documentation, so that you're going to have an interaction with folks when they come in to enroll and before they come in to enroll. So at that point, you can let them know that they'll have the opportunity to register to vote, so it's not a surprise. We are trying to tell our health centers, and we hope that they will all accept this as a fact, that assistance in registering to vote is just as much a service to our patients as is helping them apply for coverage. If we can get them to approach it that way, and I think it's really important that certified assisters think of it that way, otherwise there's less motivation to actually take that 5 minutes to actually encourage them to register to vote. And we, at least in health centers, would like our folks to really think of this as a service. In California, this is not true. In some states, the application process is going to be separate from plan selection. So there's going to be a couple of opportunities to engage people in the opportunity to register to vote. They're already, in many cases, or hopefully in most cases, going to be filling out one online form. So giving them the opportunity to simply complete another form in a couple of minutes online should not be too much of a burden. what we've learned at health centers, and I think this is true in most places, you are far more likely to get people to register to vote in a one-on-one setting than if you're just trying to do it at a table in the waiting room or if you're trying to do it at intake. So we view this, again, as another interaction when this can work. And again, because they're a trusted source, we really think we have an opportunity to engage our patients in registering to vote probably more effectively than many other settings. So we have to think through, and I'm sure all of your organizations have to think through, what are the problems in doing this as part of the enrollment process? The process may be lengthy. You're going to add voter registration to it, and so many staff, whether they're getting compensated or not for it, are going to think one more thing to do. Enrollment, not registration, is a priority. If this is going to take more time, why do I want to do it? Provides more questions for assisters and navigators to answer. And in fact, I think that's, they have to feel comfortable answering questions if we expect them to actually actively engage in the process. It's one more form for the patient to fill out. Many patients, we know from experience, if they were going to register, they would have been registered already. So they have to figure out why they should register. Will they be willing to fill out one more form? Then in California, if you do it online, it's a different story. But if you're doing it with a paper form or if you're doing it in a state that's not online, it's one more form for the staff to collect. The forms have to be collected and they have to be turned in accordance with the law. And I expect as this moves forward, we're going to find out other challenges in trying to make this happen during this process. But again, if we can get people to view this as another service they're providing along with the enrollment process, we think we have a much better chance of making it smooth and seamless and effective. So what are we trying to do to overcome these challenges? The first thing is obviously to make the voter registration process simpler and faster. We want to integrate the registration message into the outreach message. As I said, if people kind of know when they come in that they're going to have the opportunity to register to vote, you won't be springing it on them as part of the enrollment process. Have simple materials explaining and encouraging registration available throughout the health center so that, again, folks have a chance to see it and know that it's available before they engage in the enrollment process. Create a voter registration resource team. Rather than trying to expect all the enrollment assisters to know all the answers to questions that might come up around voter registration, if you have a couple of people at the health center who do know and have been trained to answer questions like what happens if you're a felon, what happens if you're a victim of spousal abuse and you don't want your voter registration to be public, all the questions that come up, what happens if you've moved, have a few people who are trained to answer these questions so they can be called upon rather than expecting every outreach and enrollment or every enrollment assister to know the answers to these questions. And then provide ongoing training and technical assistance to the staff so they can ask the question about registering to vote in a way that gets yes for an answer, and so they're comfortable engaging in the process. Again, I think it's important to understand in these formats that the people have to be comfortable asking the question and assisting, or they're not going to be as likely to be effective as we'd like. So what we try to do is, again, treat voter registration as another service and ask more than once. We are working, and Amanda will speak a little bit about this, we've worked with Rock to Vote to create a simple voter registration interface, which is on our website. And so rather than asking the question and handing people a paper form or taking them someplace else, we're going to provide a link, an icon at the bottom of the screen that when folks ask the question and the answer is yes, they can click on it, and it will take them, and I think Amanda has some screenshots of it, it will take them to this online portal, which is very straightforward. It's now available in English and in Spanish, and I believe Rock to Vote is going to have it available in 8 or 9 Asian languages as well, so that we want people to do this for 2 reasons. One is they're already engaged in an online process. This is just another step in the process. It's it's quick and it's easy and it's simple. The folks at Rock to Vote have really made it very straightforward. And also, we are able to, with the permission of the patient, capture the information for contacting them so they can get reminders about voting, updates about information about voting, absentee voting, finding their polling place, all the things that actually do more than just register people to vote, but actually get them to the polls so they actually cast a ballot. Because in the end, we're not really interested just in registering them. We want them to actually vote. Again, we're working with our folks to include voter registration in their outreach message so that folks can expect it when they come in. And in places where they are going to have to collect the forms, to help them put in place a system so that they can collect and submit the forms. So what we're providing is we're actually creating right now with our partners at Nonprofit Vote and the Fair Elections Legal Network an online training module for enrollment and other staff with the basics of doing voter registration. It'll be a basic module which will have some state-specific options to it. We'll provide legal information on state and federal requirements, the online registration portal I mentioned, and then in as many places as we can, we want to have on-the-ground partners who can actually provide training and technical assistance to the enrollment folks in the health centers so that as issues come up or as problems come up, they have somebody there that can actually come in rather than just do it over the phone. The other thing is we don't view this as just about this election or this open enrollment period, so we're trying to put in place mechanisms that will last into the future. So we also want to set up a mechanism so that we get feedback about the problems. Just as like there are going to be problems with the enrollment process, there are clearly going to be problems as we try to implement voter registration. We know that. We know that we're going to have to try to figure them out. Again, in some states, there's no way to know how this voter registration process is going to roll out, but we are working so that we can hear from folks and we can fine-tune the process, update the trainings, and make them as useful as possible. Again, not just between now and March 31st, but in an ongoing way. The goal is to integrate this into what our health centers do, not just make it a periodic activity. And that's it.
Thanks, Mark, and hi, everyone. My name's Amanda. I am the political director at Vote and basically oversee all things online voter registration for our team, so from development, maintenance, promotion, partnerships, and the advocacy work that we are doing around this. So I just wanted to say quickly, thank you for the opportunity to be on this call today. Rock the Vote is a national nonprofit organization that has been in the business of building political power for young people for the past 23 years now, and we do this with that all begins with registration. So we're excited to be talking to you all about that opportunity today. I think here we have this unique opportunity with enrollment as one way to get folks registered to vote. And I just want to talk a little bit more about the technologies because this is something that, one, comes into play with the enrollment process, but is something that you guys can do throughout your everyday programming. So happy to share some of the resources that are available. Warning that this might get a little bit wonky, but I promise it's really easy. So basically, Rock the Vote has pioneered this online voter registration technology that we have now used to register close to 6 million young people really in the last 2 presidential election cycles. It is a free widget that we make available to partners as well that you can, it essentially just guides people through the voter registration process. Emphasis on the word free. I'm happy to share it with our partners to make sure that you guys can provide a voter registration opportunity to any of the people that you will be interacting with year-round. I think that I have control here. Okay, cool. So, again, warning that this might get a little bit wonky, but I promise it's really easy. It's so easy that Wikipedia actually has an explanation for what an OVR widget is. So widgets are a small application that can be installed and executed within a web page. It literally just occupies a portion of that web page and does something useful with the information fetched from the other websites and then displayed in place. I can show you a couple of examples momentarily. Okay, so this would be one example here. You'll see the register to vote. This is living on the site just as a widget. So when somebody clicks that button, they will be presented with an overlay, and that then brings up the registration form. Having a little bit of trouble actually moving from one slide to the next. Thank you. Okay, so this is, you'll see you still maintain the the original site that you were choosing to interact with, and then the voter registration portal comes up, and this is a simple wizard for somebody to complete the actual voter registration form. Basically, we are collecting the information needed to do so and then pre-populating a voter registration form, which is then emailed or in some cases even printed immediately on site, like we're doing with some of the health centers that Marc was speaking about before. Just to give you a quick couple of examples here, again, the way in which that we work with partners, going back to the 2008 election cycle, having literally led about close to 3 million people through the tool at that point. We really wanted to, this is not something that is proprietary, and we wanted to make it available to our partners. So over the last couple of years, we've done a lot of work to customize it and present, give our partners a little bit more flexibility in terms of how they're presenting the voter registration opportunity on their site. So you'll see this is a version of the white labeled tool set that we offer to partners. So this allows you to take the portal that we are providing and customize it to really match the look and feel of your own site. This screenshot is the first page of the tool that we have now built for Marc and the National Association of Community Healthcare Centers, just based on the demographics of the people that would be using the tool in that setting. Many of them do not have an email, which is traditionally has always been the first point of entry for a lot of the work that we're doing, just because we work primarily with young people. But again, it goes to show the level of customization that we are happy to do with our partners. So this is the first page where we're actually asking people if they have an email address, and if not, well, if they do, then we will send them a copy of the registration form once it's been pre-populated. Otherwise, they will be printed on site. And then the second page of this interface, move to the next slide. The second page of the interface, you'll see you can actually begin the registration process. Again, it looks and feels like Marc's website, so it has his colors and kind of the fonts that he's selected and things like that, just to really match the look and feel of the National Association of Community Healthcare Centers site. Okay, so the benefits to this, besides the obvious. So the registration wizard is going to help an applicant, really just guides them through the registration process. We provide tips that are state specific. We actually maintain a database that for all 50 states, so that when people are going through the form, they are prompted with the right tips as they're going through. So for things like what ID is necessary, whether or not you need to or provide your race, because in some states you don't, for example. The second point, the data is entered by a user into a user-friendly form. We have tested interface after interface after interface and are even at this very moment running some A/B testing on 2 different interfaces. So we are constantly trying to present the interface that is going to increase the completion rate of the actual tool, but also decrease error. So when the information gets entered, the kind of common mistakes that are done when somebody's using the voter registration form, as in they will enter their birthday instead of the date that they are signing the form or things like that. There are roadblocks within the site so that you cannot actually make those errors. And then it works. We've been using this tool since 2008. We've always really prided ourselves in being on the frontier and kind of cutting edge of all these technologies. The current system that we are working with has been live since 2008, and like I said before, we've had more than 6 million people process and download voter registration applications through this tool. And it's free, so why not use it? You can go to the next slide. Okay, so here's how it works. Again, like I said, we're a national organization, and we are providing this tool to essentially, I think at this point, our latest partner count was close to 25,000 people in all 50 states, with the exception of North Dakota, obviously. They do not need registration there. But the way that it works in California right now, because the state is online and we want to give all of the people that are coming to Rock the Vote or any of those of our partner sites the opportunity to complete the process online, we collect information. So that is the information that you would need to kind of build political power. As Marc was describing this before, there are opportunities for you to communicate beyond just this registration ask, and so we're collecting enough information for you to do so, and then we transfer them to the Secretary of State website to complete the registration process online through the cover interface. Right now, go back really quickly. Right now, the state is working on upgrading the cover interface, which they expect to roll out in March of 2014, and we are working closely, very closely with them to make sure that the system that they then roll out is integrated with the Rock the Vote interface or that of any of our partners for that matter. And once that happens, the applicant that moves through Rock the Vote or the partner interface will be sent to the Secretary of State site with 90% of the data required to complete the registration process moving over also. So the information that they are, submitting to us, to the partner, will also be transferred to the Secretary of State so that the user doesn't actually have to rekey that information. Next slide. So how do you do this? You can just go to rockthevote.com/partner and sign up. There are some basic, we'll walk you through kind of how to customize the widget to make sure that it works for your website. And then at the end of that process, which is literally 5 minutes, you will get a code to embed it. You have the option of choosing between a 5-page interface or a 2-page interface. You can add your logo and header. You can add in survey questions in case you're interested in learning a little bit more about your audience. And then you can also do some opt-ins so that they opt in to hear from you, and you can kind of further your own relationship with those folks. And then if you want to customize it even beyond those basic opportunities, you can also always just contact myself, and I can tell you a little bit more about the white label feature set, which is very similar and one of the things that Marc took advantage of in when we were building up his tool. A couple more quick slides just to show you the way that this works on the back end and the benefit in terms of really building community and building power within the folks that you are registering. So this is what the partner portal looks like. So you will have unique access to get into this at any point. Go to the next slide really quickly. At which point you can find out who has moved through your unique tool. So you can check, obviously, Heather Smith has not been registering that many people this week, unfortunately, but your numbers would be much higher, I hope, and then you can kind of see how many you're doing. You can download full reports, at which point we would be able to share all the demographic data about the folks that are moving through your unique tool.
Amanda,
cool.
Oh, sorry, I thought you were finished.
No worries. Just finally, my name's Amanda Brown. You can always contact me at Amanda@RockTheVote if you guys have any questions or want to learn a little bit more. And I can also work with Anna to share some of the promotional materials that we have about the tool if folks are interested.
And Amanda, can you answer 2 quick questions that we've been getting from a few different groups? One is, just quickly, how does Rock the Vote, what do you use with the info entered? Do you use it for any purpose other than voter registration? And secondly, when a partner uses this widget, does Rock the Vote get the data, or does just the partner keep the data?
Got it. So it is your data. Our mission is to provide an opportunity for you to build power within your own audience. So what happens when somebody enters their information, it basically goes to a server which is run out of Oregon State University labs, and it is a private server. So I really never want to be responsible for the social security number, like driver license information that we're collecting through this process. And that information is then, basically it lives on this server for 7 days so that we can do somewhat of a chase to make sure that people are actually printing and signing and mailing in the form in most states, because California is on the good side of this and actually allows the online opportunity, but in most states we're not there yet. And then what happens after that that is after 7 days, the information gets stripped of any personal identifying information and moved over to a pair server, which we would then have access to. And really what happens is, like, I guess technically the data exists within our kind of applicant pool, but we don't communicate with them unless the partner is interested in Rock the Vote having that communication with their people in terms of like sending voter registration deadline reminders or even election reminders and polling place information. I think that was actually one of the slides that we did miss in terms of like the benefit and the opportunity for Rock the Vote to kind of assist, and we are tracking elections all day, every day, so if we can be of assistance in that regard, we are more than happy to do so. So hopefully that answered the second question.
Yeah,
and the first one a little bit. Okay.
I want to jump to a couple other questions. We're almost to the end of the webinar, so I want to hit on a few. I would normally kick this one to Raul, but in the interest of time, I'm going to go ahead and answer it. One question was whether, someone asked whether enrollment counselors, navigators, and outreach people are required to offer registration. The people that are required to do it are, under law, are the enrollment counselors, which encompasses navigators and what were formerly called assisters, the people who are actually enrolling people and offering the service. Secondly, there was a question about how do you keep people from improperly influencing someone who is registering to vote, keeping them from influencing them on political party preference or putting pressure on them to register to vote when it's not required. That is done, first of all, this law is 20 years old, and lots of state agencies have been doing voter registration for 20 years and training their workers to do it in this way. And there are two things you can do to prevent that improper influence: thorough training of the people who are doing enrollment on the requirements for voter registration, and secondly, making sure that voter preference form is done properly and includes the proper disclosures so that the applicant knows where to call if they're having problems or if they've been harassed or improperly influenced in any way. Finally, I want to ask Elizabeth really quickly to answer a question that I have, because yesterday the exchange actually noted that the Covered California website, portions of that may go down. The Covered California website may go down for this week before the launch. And so if people are going onto that website for the first time from this webinar, I want to make sure they understand what's going to be available and what isn't until October 1st. Elizabeth?
Yeah, Lori, I'm not sure I'm a good person to answer. I don't know the answer to that. I was actually on the website earlier this morning and was able to get on, but I don't know exactly what portion will be unavailable. But as Lori said, they did announce that while they're kind of getting ready to upload the actual application, portions of the website will not be available.
So just don't, the message is don't panic if you go on there and things seem a little funky, because I think there will be parts of it that may be unavailable. And finally, I want to emphasize something that our partner, Asian Americans Advancing Justice, just sent me, and it's important, especially if you're in those language communities. Those folks are going to be applying through paper, and as of right now will not be given a preference form and voter registration card. And so, you know, we obviously are urging Covered California to make that available as soon as possible. But for those of you doing enrollment in those communities, please be aware that if you have the resources available to go and get those voter registration cards and the information from county elections officials and can provide that, that's great. But note that they aren't going to be given, you know, the equal opportunity that others are to register online until the spring of next year. Finally, I want to thank everybody. This is a huge work in progress, but it's a huge first step. We're going to follow up with you in an email that will include these slides from today's presentation. The webinar is being recorded, so there will be a link to that, an email address that you can where you can email us, and we'll try to answer some of those questions we couldn't get to today. I want to encourage people to send us their suggestions, their feedback, their experiences, so we can share those best practices, and we'll send you updates on voter registration at Covered California as they move toward inclusion of the materials in the paper and the online system. Thank you, everyone, and good luck as we move toward October 1st. Thanks so much for participating today.